Before making the skin incision or before the procedure is started, a qualified personnel will verbally announce and conduct a timeout. This involves the presence of the surgeon, anesthetist, physician, and the necessary team members such as midwives or neonatologists for cesarean sections if requested, or a lab tech during the bone marrow aspiration. It's important to ensure the whole team A, available, alert, attentive, aware during the time-out process. First, verify the patient's identity by checking the patient's full name, date of birth, and medical record number against the surgical and procedure consent and the patient's identification band. Then, confirmed all team members have introduced themselves by name and role. Follow by, confirm the correct procedure by reviewing the surgical and procedure consent and verifying it with the X-ray or imaging display. Confirm the correct site of the procedure by visually inspecting it. This is particularly important for procedures involving multiple sites or bilateral procedures. The site marking should be done by the responsible physician. There may be different opinions on whether to introduce the patient or the team member first. However, following the checklist, team members should introduce themselves first. For example, I would announce, "Good morning, everyone. Time out. I need your attention, please. I am Kai Lee, the circulating nurse." Subsequently, other team members would introduce themselves. Then, we confirm the patient, procedure, and surgical site following the checklist sequence. It is following the checklist. I'm not saying who is right or wrong. We just follow the checklist, reading it aloud, no need for a script. Following the surgeon's address about any specific concerns related to the patient or procedure. Confirm if blood products are needed. Ask the anesthesia team for patient-specific concerns. Review by the nursing team includes equipment checks, instrument sterility, implant availability, and correct patient X-rays or imaging displaying. Announce the patient's allergic status. Inquire about antibiotics in the last 60 minutes has been given by the anesthesiologist or surgeon. Announce the timeout it's over and ensure documentation on the checklist.
Ready for timeout?
Okay.
Can everyone introduce themselves by name and role?
Mark Kenny, consultant anaesthetist.
Sampal Chanel, anaesthetic registrar.
Paul Ziprin, consultant surgeon.
George Peach, surgical SHO.
Angela Zupan, circulating nurse.
Natalie Modeste, scrub nurse.
Andre Chow, surgical registrar.
Anna, anaesthetic nurse.
Okay, what's the patient's name, procedure and site?
Janina Davison for laparoscopic cholecystectomy. Her name tag's already been checked.
Okay, any expected blood loss?
Minimal.
Specific requirements?
Laparoscopic cholecystectomy, which has been checked already.
Okay, and critical steps?
Possibility for conversion to open surgery.
Any specific concerns? Anesthetics?
None.
ASA?
2.
And monitoring equipment?
All present.
Okay, is the sterility checked?
Yep.
And any equipment issues?
I've got the standard laparoscopic equipment. Would you be requiring anything extra?
Well, we have the open set on standby.
Antibiotics?
1.2 grams of augmentins in the patient.
And warming?
Bear hugger.
Hair removal?
Not required.
Glycemic control?
Not indicated.
And DVT prophylaxis?
TED stockings as standard.
Imaging displayed?
Not required.